Good morning. Yesterday, the World Health Organization announced that on Sunday, more than 183,000 new cases of COVID-19 were reported globally, and this was easily the highest number of cases reported in a single day. So around the world, there have been over 9.1 million cases. And while some countries like Canada have been successful in slowing the spread of COVID-19, many countries are experiencing a rapid increase in new cases and deaths. And other countries that were able to flatten the curve are now seeing an increase in new cases as they begin to reopen and relax public health measures. So we continue to face that delicate balance between protecting people from COVID-19 while minimizing the negative social and economic impacts of extended restrictions. Across Canada, there are more than 101,000 cases and 8,436 deaths. And I think it's important to remember that these are not just numbers of cases. Each case has impacted and hurt families and communities. But we do continue to see a decline in these new cases in Canada. The average number of new cases per day in the past 7 days was the lowest 7-day average since March the 26th, and was 27% lower than the previous 7 days. And the average number of deaths per day in the past 7 days in Canada was 41% lower than the previous 7 days. In terms of testing, P.E.I. has now done 10,183 COVID-19 tests. 1,167 of these are new negative tests since last week. And the number of tests we're doing per million is very similar to the Canadian average. I do want to thank all those who are doing the testing at the clinics and in the ERs. Our COVID-19 inspections are being done, and these are being done in businesses, restaurants, retail stores, and a total of 299 of these have been completed. And I want to thank our environmental health officers who have been doing a large number of these inspections. We are so fortunate in P.E.I. that we've had the capacity to put in place Operation Isolation. And it is calling every person in self-isolation, and it's an opportunity to make sure there is support there for people and make sure that people understand the restrictions of self-isolation. And the feedback we have received on these phone calls has been overwhelmingly positive. Currently in self-isolation, there are 979 people, and a total of 6,303 people have completed self-isolation to date. And that is an incredibly big number and a lot of phone calls. I'd like to thank all the people who have been making those calls. I was asked to remind people that self-isolation does mean staying on your own property for that period of time. We've also been asked different questions about the travel approval to Prince Edward Island. And in the different categories, essential workers, to date, there's been a pre-approval travel for 1,795 people, and there have been compassionate approvals for 1,410. The family support category that was announced recently, in the first week of its stream, 179 people have been approved in that category. The Office of Public Safety has also been processing the seasonal applications, and to give people a sense, there were 388 seasonal applications due to arrive approvals for the week of June 15th to the 22nd, and 317 applications which were approved for the week of June 22nd to the 28th. And again, just over 300 for the week of June 29th to July 5th. And then the following week, it goes down to 131 seasonal applications processed for that week. Phase 4 of Renew P.E.I. together begins this Friday, June 26th. And phase 4 is a continuation of the progressive lifting of public health measures. And during this phase, larger organized gatherings of up to 50 people will be reintroduced. This includes things like worship services, organized sports, day camps, and events like weddings and funerals. For these larger organized gatherings, an operational plan is required and limit the sharing of equipment among individuals from different households. And we do not recommend sharing of food. For facilities with separate rooms or large spaces that can accommodate more than one gathering, such as a larger church, multiple gatherings, 250 people gatherings, totaling up to, totaling the 100 may be held at one time, as long as the groups may be separate and not mix. And of course, these would require an operational plan to be approved. Additional businesses and NGOs will also be permitted to reopen in phase 4, and we've talked about them before, but they include things like facials and piercings where there's close contact, and precautions still need to be taken in situations where you cannot maintain physical distancing, for instance, and where appropriate, non-medical masks should be worn. VLTs will also be open and accessible to the public. In phase 4, an increase of 3 children in the age grouping of 22 months to school entry will provide increased capacity in licensed childcare centers. I have been advised that there are childcare spaces available across the province. And I know last week I was asked about sleepovers, and sleepovers with children from different households may occur subject to the following. Child coming for a sleepover should either be in a different room or in a bed at least 6 feet apart, and really try to restrict sleepovers to having one child or siblings from the same household. There has been lots of discussion about the Atlantic bubble and allowing travel between P.E.I, Nova Scotia, New Brunswick, and Newfoundland. And as Premier King has spoken about several times, the Atlantic premiers are committed to a bubble to provide safe and efficient travel throughout the region, and this would be without the need to self-isolate. And my counterparts, the chief medical officers of health in the other provinces, have also been discussing this bubble. And it is based on the fact that we've seen low numbers of cases in the region and how it's being managed in our Atlantic Canada region. However, with an Atlantic bubble in place, it's important that islanders know their risks. And it's still overall recommended that we think small and think local. Self-isolation would be required for anyone traveling from an area outside of Atlantic provinces. It does mean also that the importance of the basics continue. Social distancing, good hand hygiene, not going out when you're sick, enhanced cleaning, and keeping separate if someone is staying at your home that is self-isolating. Screening would still continue at the bridge, ferry terminals, the airport, and other points of entry to ensure that those needing to self-isolate have the support to do so, and that everyone is well aware of our restrictions. With each new phase, we get questions about what is next. And there may be additional phases beyond phase 4, as each phase moves us to a new way of life and a new normal for Prince Edward Island. Any decision to progress to a new or different phase is based on our epidemiology, the number of cases in P.E.I and across Canada, our ability to do contact tracing, and our health system's capacity to manage outbreaks. We continue to look at solutions to help us adapt and live with COVID-19. As long as there is COVID-19 in the world, and we're in the middle of a pandemic, there will be risk to Canadians and to islanders, but we are trying to minimize that risk. And it may be easy for us to forget on a beautiful day, and that it's been so long here in P.E.I since we've had a case of COVID-19 that we almost forget about it. But as we go into these next phases, into phase 4, and we lift some of the restrictions, we talk about an Atlantic bubble, it's more important than ever that we don't forget to be careful. And by working together, we will continue to be safe, and we want to take deliberate steps in a response to this pandemic. So let's continue to look out for each other. Let us be patient and kind. Enjoy this beautiful day in Prince Edward Island. And also congratulations to all the graduates of 2020. So thank you.
Good morning, everyone. The Joint Response Team remains at a response level of 2 with enhanced monitoring and planning happening. Work to develop and operationalize our surge plans throughout Health P.E.I. to respond to future cases of COVID-19 continues. In long-term care, work continues related to the reactivation of the former Riverview Manor and Montague for the use to care for COVID-19 positive long-term care residents if necessary. To reflect the center's new use and its location, the facility will be called the Rosedale Care Center. COVID-19 screening clinics have increased their capacity to meet the swabbing requirements for testing of seasonal residents and other individuals identified to be swabbed. Our visitor protocol continues to be reviewed with now a focus on modifications related to long-term care to include indoor visits and clergy and faith leader visits from our communities. It will also include some further changes to our extended care homes within mental health and addictions. Any changes in this will align with the Phase 4 of Renew P.E.I. Together plan, and further announcements will be made when those changes happen this week. Supplies continue to be closely monitored as the supply chain issue continues globally for some items. Personal protective equipment such as disposable gowns, surgical gowns, masks and visors, hand sanitizer and soap are of course priorities, as are medicines, ventilators and associated equipment. More services continue to open across Health P.E.I. under the guidance of the Services Reinstatement Team, and more services continue to plan for easing back into their new normal on P.E.I. with health services, and more non-essential services will be approved to get these areas more close to their top level of their normal service level. This is all being done while continuing to adhere to the physical distancing measures where possible and using the appropriate personal protective equipment and continuing to have those operational plans in place. So we appreciate everyone's cooperation as we move to shift some of our services to look different, require maybe appointments and calling ahead if you bring support people with you. And thank you for your patience, and thank you to our staff who've really adjusted things to offer these services again while continuing to work in a new way of being on P.E.I. Thank you.
Thank you, Marion. And just before I open it up for questions, I certainly meant to thank the Office of Public Safety and the Emergency Measures Organization for their tremendous work in going through the number of approvals that I talked about, because it has been a significant amount of work for them. So thank you. And I'll open it up for questions.
Nicole Williams, CBC.
Hello, everyone. Hope my audio is okay. I'm just calling from home. My first question is for Dr. Morrison. The Premier has said he was going to speak with you about the Atlantic bubble and how to handle non-Atlantic residents traveling, since Nova Scotia and New Brunswick want to open up to the rest of the country in July. Is opening up beyond Atlantic Canada even on the radar here?
Hi, Nicole. So I think the first step would be more the Atlantic bubble. We're looking at the number of cases that are going down across the country, but I think it would be important to start with the Atlantic Canada and see how that goes. Watch our numbers, watch our cases. we've always said a bubble can be fragile by its very nature. So I think it would be a good first step, and then we'd look at what is going on around the country, what's going on here, and then make a decision at a future time.
Okay, so just to clarify, at no point right now are we looking to open up to the rest of Canada?
Well, I think, Nicole, at some point that might happen and could happen, but at this point we're focused on Atlantic Canada and trying to establish a date for that, and that is part of the discussion that the premiers are having, and I think that would be the first step before we move on to the rest of Canada.
Understood. Thank you. And my next question is, I'm wondering if you can just clarify on the 2 rooms of 50. I think that's something that's new today. I'm just wondering if you can explain how that works and what are the rules around that.
So it's really, we call it our multiple gatherings, and there will be some more detailed information. If it's not already up on the website, it will be going up today. And it's around those larger organized gatherings, and recognizing that I use the example of a large church that may be able to accommodate more than just the one group of 50. And it would mean that there shouldn't be mixing of the 2 groups, so they might use separate entrances. They still, in the gatherings, they need to maintain the physical distancing, and there shouldn't be mixing of the 2 groups. And so I think that will help in certain situations. Also, sports fields and some sports activities would be also wanting to use those 2 groups of 50 in certain locations. If they are going to have 2 groups of 50, that's an operational plan, should be reviewed by our office, and they are currently being reviewed as well.
Thank you.
You're welcome.
Jessica Doria-Brown, CBC.
Hi there. My first question is for Dr. Morrison as we think ahead to this Atlantic bubble. Can you give me any details about what screening might look like at the bridge? Obviously, we'd probably expect large numbers of people those first couple days in particular. So what plans are being made to deal with that, to avoid massive backlogs of traffic?
Yeah, so I think some of those discussions are why we're still in the middle of looking at some of the logistics around it. So, and one of the discussions we've had is certainly that it's important to have residents of those other provinces. So, and how do you identify that? Is there a pre-approval process that can be shown at the borders, at our interprovincial borders? So we are certainly those are the logistics that we're trying to figure out so that there isn't a huge backlog. It's actually gone fairly smoothly with the screening to date, with essential workers and others coming back and forth. The screening will still be asking the questions if people are ill, anyone ill in the car, have they been with anyone who might have COVID, where are they from in terms of, or have they been outside the country, for instance, in the last couple of weeks. So those kind of questions would continue, and it's a matter of how do you have flow of people between the Atlantic Canada, but still have a sense of how many people are coming and going, and I think we recognize there's a lot of connections in Atlantic Canada, and the case numbers have been really low in Atlantic Canada, so it is something that we think is important, but we will do so cautiously, and I think that's why there's not been any announcement of a date, and that will be up to the premiers, and I think they'd like to figure out some of those logistical details before that announcement's made.
Okay, thank you. And my second question is for Marion Dowling. Wondering whether you can give me any more details on the preparations underway for the next phase of visitation at long-term care facilities, and specifically are inside visits planned for this phase?
Hi, Jessica. Yes, they are planned for this phase. We're looking at indoor visitation and looking at similarly having designated visitors, looking at designated spaces for the visitors so we can have that enhanced cleaning happening in between visits with different family members or support people coming. And the other part that we're looking at is those community clergy or faith leaders that also are an important part that may have been one of the designated visitors for a resident up to now, but they would be able to come as well with some scheduled visits to the residents of those homes.
Okay, thank you very much, both of you.
Alison Jenkins, The Guardian.
Yes, hello. I am looking for a bit more information on small business owners are having a hard time in the pandemic with public health measures, keeping people home. Just wondering what sorts of mental health supports are available for small business owners who may not have health benefit insurance plans. Thank you.
Maybe I can answer a little bit of that. We've talked a lot about a number of different mental health services that are available, and I can certainly provide you with an updated list of those so that you can publicize those as well. But the urgent care clinics, the mental health walk-in clinics are all available and free of charge. There's no cost for those services. There's 1-800 telephone numbers, some of those consults, and those things are provided without coverage to Islanders. So I think there are a number of ways that people can receive service, and if they are seeking help, then we really want them to know where to get it. So I can provide you with a list of those. I don't know that I have all the details here with me today, but we'll certainly get them to you today. They are available on the website as well, but we'll make sure we send you the list.
Okay, that would be fantastic. I appreciate that. And I think that's all my questions. Thank you.
Okay.
Thank you, Allison.
Rachel Collier, Graphics. Rachel Collier, Eastern Graphics. Okay. Laurent Rigaud, La Voix acadienne.
Good morning to you both. Dr Morrison, j'ai une question pour vous en français sur, vous avez donné les chiffres des arrivées des résidents saisonniers à Lille. Est-ce que vous pourriez redonner ce chiffre en français, s'il vous plaît? Et aussi confirmer que maintenant, les résidents originaires de certaines régions du Québec et de l'Ontario sont bien autorisés à venir à Lille et qu'il y en a déjà qui sont arrivés, s'il vous plaît.
Bonjour Laurent. Alors, je vais essayer de les dire en français. Alors, les arrivées des résidents saisonniers commençaient la semaine passée, et puis il y avait 388 qui sont, c'était ils sont approuvés d'être ici pendant cette semaine. Cette semaine ici, le 22 juin jusqu'à le 28, il y a 317. La semaine qui suit, le 29 juin jusqu'au 5 juillet, c'est juste plus de 313. Et puis, le juillet 6 à 12, c'est 131. Et mi-juillet, c'est 104. Et le 20 à 26 juillet, c'est 52. Et puis, ça continue comme ça. Et puis, le bureau de Office of Public Safety sont faits en commençant avec les résidents saisonniers des régions atlantiques, et puis des territoires et du ouest du Canada, et puis après ça, avec Ontario et Québec. Et puis, ils ont fait ça dans cet ordre. Et puis, il y avait peut-être des résidents saisonniers de la Nouvelle-Écosse qui ne voulaient pas venir avant le mi-juillet. Et puis, il y avait... Alors, ils ont fait dans cet ordre et puis ils ont mis dans la semaine qui voulait venir. Et puis, ils ont commencé à avoir quelques-unes, un nombre plus petit qui arrive d'Ontario et Québec quand ils ont fait leur application. Alors, ça... Comme j'ai mentionné les numéros, ça va continuer à 300 à peu près dans les 2 semaines qui suivent. Et puis après ça, c'est 131 et 104. Alors, on a dit on ne voulait pas plus que 500 par semaine à cause de la capacité des appels pour opération isolée. Et alors, on est bien moins que le 500 nombre.
Merci. Et j'avais également juste une question sur la bulle atlantique. Donc, vous l'avez dit en anglais, je crois, ça reste l'objectif aujourd'hui, la bulle atlantique. Et pour le moment, il n'est pas question de s'ouvrir au reste du Canada, comme on l'a entendu en Nouvelle-Écosse la semaine dernière.
Oui, on va en discuter et puis c'est une possibilité pour certains, mais on va commencer avec la boule atlantique pour commencer. Après ça, on va regarder le nombre ici à les cas ici à l'île du Prince-Édouard, qu'est-ce qui arrive dans la région et puis qu'est-ce qui arrive au Canada. Alors, on va faire une décision après ça, mais on va en penser, mais pas à ce moment.
Merci beaucoup.
François-Pierre Dussault, Radio-Canada.
Good afternoon to you both. J'ai une question pour vous en français, Dr. Morrison. C'est un peu par rapport aux questions de mon collègue de la Voix acadienne. Pour ce qui est des résidents saisonniers de l'Ontario et du Québec, donc vous confirmez aujourd'hui qu'il y en a qui ont effectivement obtenu l'autorisation de venir à l'île. Est-ce qu'on sait combien d'entre eux ont eu autorisation pour venir au cours de la semaine dernière et des prochaines semaines?
Je n'ai pas bonjour François, en commençant. J'ai pas le nombre ici avant de moi, mais je pense qu'il y en avait 5 la semaine passée, puis peut-être une vingtaine, mais cette semaine, mais j'ai pas les nombres en avant de moi, mais c'était, comme j'ai dit à Laurent, c'était en ordre de priorité qu'on a suivi qu'est-ce qu'on a dit qu'on faisait en commençant avec les maritimes. Et puis, on sait aussi qu'est-ce qui arrive partout au Canada, le nombre des cas diminue. Et pour nous, on est unique qu'on a une opération pour faire les appels et on les suit. Alors, l'important, c'est qu'il reste en auto-isolé, n'importe d'où il vient. Et alors, le nombre de personnes, je pense, pour les résidents saisonniers sont bien moins qu'on a pensé le 1er juin qu'on a discuté, mais il y a juste un petit nombre qui ont commencé, mais la priorité était avec les autres provinces pour commencer.
Dans un même ordre d'idée, Dr. Morrison, pensez-vous que la stratégie de communication aurait dû être différente parce qu'il y a beaucoup d'insulaires qui n'attendaient pas les Ontariens et les Québécois aussitôt dans la saison? On pensait que leur demande allait être traitée beaucoup plus tard, peut-être en juillet ou peut-être au mois d'août. Et le fait que ces gens-là sont ici maintenant, ça peut amener des incidents malheureux. On en a vu d'ailleurs avec des cas de gens avec des plaques d'immatriculation hors de la province qui ont dû être victimes d'intimidation, de graffiti, de vandalisme. Est-ce que la province aurait pu dire les choses différemment, annoncer d'ores et déjà qu'il y avait des résidents ontariens et québécois qui allaient pouvoir venir dès la moitié du mois de juin plutôt?
François, je ne pense pas. Je pense qu'on on doit se souvenir que beaucoup des provinces n'ont pas ces restrictions sur leurs frontières interprovinciales. Si vous pouvez voyager en Colombie-Britannique, Alberta, Saskatchewan, Ontario, Québec, et vous ne devez même pas auto-isoler nécessairement, ne les suit pas. Alors, on fait des choses qui sont... on a plus de restrictions, il faut faire les applications, il faut être appelé pour 14 jours quand vous êtes ici. On a toutes sortes de choses. Je pense qu'on a bien fait ici. Et puis on a fait ce qu'on a fait avec le nombre qui commençait. C'est pas, j'ai mentionné en anglais que on a déjà on a approuvé 1400 personnes déjà pour les raisons de compassion et pour les travailleurs essentiels, presque 1800 personnes. Et puis, ils arrivent de n'importe où. Alors, on a beaucoup de personnes qui arrivent ici pour d'autres raisons. Ils sont étudiants peut-être. Ils arrivent d'autres provinces, ailleurs. Et puis, on les a suivis pendant les 14 jours pour auto-isoler. Alors, je pense qu'on doit mettre les nombres et les résidents saisonniers en contexte avec les autres nombres.
Merci beaucoup.
OK, merci. Some of those questions I know I always get asked. Laurent from the Voix acadienne asked me a couple of questions that really I'd already addressed in English, and really Francois' questions were follow-ups from that about the numbers related to seasonal arrivals here, and trying to put these numbers in context of all the people we've have been approved by Office of Public Safety for essential reasons, compassionate reasons, family support reasons, who've come from all parts of the country and elsewhere, and we have something that's fairly unique in Prince Edward Island in that we have the Operation Isolation. Well, it is unique for interprovincial travel, and when you look at the numbers of people that have been called, and I think it's quite incredible, and so we are doing something that has worked, and we need to continue to do that from the areas that are the highest risk. So thank you very much. Like I said before, enjoy this beautiful day. Thank you.